Okay, class, now we're going to talk on blood vessels. Blood vessels. This will be the blood vessel chapter. Depends on what text you have. It'll be chapter 19 in this particular book, but depending on what book you have. Okay, types of blood vessels we have. Arteries, arterioles, capillaries, venule, and veins. We have 4 generic blood circulations, I'm going to say, in the body that can suffer hypertension. The systemic circulation. The systemic circulation goes from the left ventricle, it does not include the left ventricle, so we start with the aorta, to the right atrium. The pulmonary circulation goes from the right ventricle, which would really be the pulmonary artery, or pulmonary trunk, through the lungs, back to the left atrium through the pulmonary veins. The portal circulation is a venous circulation. The coronary circulation we talked about in the heart, that's the circulation to the heart. Okay. You don't suffer hypertension in this one, but you could in the systemic hypertension, hepatic portal hypertension, and so forth like that, and pulmonary hypertension. Here's just a little drawing showing you this particular aspect here. Let's blow it up a little bit. This shows the heart, systemic, going around, coming back. So this is like a schematic of the systemic circulation. Okay. This is a schematic of the pulmonary circulation. Blood leaving the right ventricle, going in the pulmonary artery around to the lungs, and ultimately coming back through pulmonary veins into the left atrium. This is a schematic of the hepatic portal circulation, which is a venous circulation. Blood that drains from the intestine ultimately goes through the hepatic portal vein through the liver. And you can get hepatic portal hypertension. All right. So that was just a little demo. Systemic, pulmonary schematic, portal schematic. All right. This here is a cross section of the blood vessel. So now we want to talk about the blood vessels, the anatomy cross section of the blood vessel. Okay. The first layer that you have of the blood vessel. So the blood vessel is arranged in layers. It's arranged in and these are called tunics. A tunica intima, a tunica media, and a tunica externa. So the blood vessel has tunics. Now this is a generic cross section of the blood vessel showing all the tunics. Depending on the blood vessel, you will not have all these tunics, but this is showing all of them. So let's go back. The tunica interna, which is the innermost, these cells, the first thing that you come across is the endothelium. The endothelium. Now that's the layer that touches the blood. We've talked about that. You just may have never seen it. We talked about it in the heart section. And even in the blood section, I mentioned it. It must be very smooth. These are simple squamous cells so that you don't kick off factor 12, the intrinsic clotting system. All epithelia rest on a basement membrane, AP1. So underneath that is a basement membrane or a basal lamina. Then underneath that is a small amount of loose connective tissue. So endothelium, basement membrane or basal lamina, then a little bit of connective tissue, small loose connective tissue. In some vessels, you'll have a surrounding layer of elastic fibers known as the internal elastic lamina. Okay, this would be primarily your muscular arteries. Okay, and we'll be talking about the type of arteries as we go along. The next is the tunica media. The tunica media is composed of various amounts of smooth muscle for vasodilation, vasoconstriction, some loose connective tissue interspersed within, and muscular arteries have an external elastic lamina. Okay, so only these arteries have that. Okay. We go to the next layer, which is the outermost layer, which is the Tunic External, also called the Tunica adventitia. It's the outermost layer of blood vessels composed of fibroblast, collagen, a connective tissue, in other words. This layer becomes continuous with connective tissue. Now, the vasa vasorum, I brought this up in the lymphatic chapter. Remember, these pipes here are living. They have to have a blood supply themselves to stay living. They carry blood throughout the body, but they too must stay living. If the pipe wall is thick, like in the larger arteries, then you would need some blood vessels to the blood vessels. You see up in here? See that right up there? You would need blood vessels in the wall of the blood vessels. They would be stealing some blood from here. The thinner ones won't need that because they can take a little bit of the oxygen and nutrients from the blood they're circulating. But if the wall is too thick, you're going to need some vessels to vessels. And that's what we call the vasa vasorum. We saw that not only here in the blood vessels, but in the larger lymphatic vessels, if you go back and look. So that gives you the cross section of a blood vessel. The cross section of a blood vessel. Okay? The tunica interna, the tunica media, and the tunica externa, known as the adventitia. Okay? Now, the types of blood vessels, we go back again. Arteries, technical definition, we'll be getting to it, carry blood from the heart. It's an anatomical term, not necessarily a physiological. That means that arteries sometimes may not be oxygenated, have oxygenated blood, like we saw in the pulmonary arteries, because the arteries carry blood away from the heart. The arterioles, some will call small arteries. We'll give a better definition. But these, OLE means little. These we'll talk about are called your resistance vessels. I'll give you why that is. We'll be doing some mathematical look. The capillary bed, or the capillaries, are very thin. That's where diffusion occurs. So the arteries and arterioles, you don't take stuff in and out. These are just conduits, hallways to get you to here, to the capillaries. That is the exchange vessels. Why can they exchange? Because they're very thin. We'll look at some mathematical analysis of that. The post-capillary venules also are very thin. They're after the capillary. They're starting in the venous side, but they're post. This is where a lot of white blood cells can come in and out. Remember diapedesis? Diapedesis was discussed in the white blood cell section. Then you have the venules. Then you go to the small, medium, and large veins. The large veins lead to the heart. These would be the vena cavas and so forth. They, in fact, are your capacitance vessels. We'll be studying that. But I can say this. Capacitance. That means to hold something. If we go here, and I'm going to enlarge this a little bit. Come down. Look at where most of our blood is right now. Our blood right now primarily is in the veins. If we were to die, we would also have a modified rigor mortis into the smooth muscle, and all the blood would pool in the veins. All the blood would pool in the veins. As a matter of fact, a little side story. Remember I said that arteries are blood vessels that leave the heart? The word artery means to carry air. Now listen to me. Here's what happened. In Roman times, a long time ago, when they first started cutting on bodies, they couldn't cut on anything living. That was against Roman law. So they would cut on dead bodies. When you die, the arteries contract tight, almost like a rigor mortis, and all the blood goes to the veins. Now, even the blood that goes to the vein pools in what we're going to call the dependent area of the body. That means if you die on your back, all the blood will go into the back veins. That's one of the ways in criminal medicine they determine the position you died in, even if somebody moves the body, because the blood would have pooled in there and gotten clotted. Well, when they cut on certain vessels, there was nothing in them. So they said, apparently, not knowing that they carry air. So they came with the word artery, to carry air, even though it does not. But upon death, it would appear that way. So a little story to give you how the term came about. All right, so we go further. We come back. Here would be a picture of, see, here's an artery and here's a vein. Veins are larger many times, and therefore they have more room to carry blood. Okay? So now we would go to arteries. But I'm going to end this video here. Now, sad to say, what's going to happen, we need to do some math. So you may want to get out a pencil and paper now, because I want you to be able to understand this resistance and all this other stuff. See, listen to me well. When you're dealing with something that can be explained mathematically, quantitatively, it's best to do it. Because when you try to explain it qualitatively, well, it's kind of like this, it's kind of like that, that doesn't hit the mark. See, math hits the mark. When you try to do it qualitatively for something that could be exactly described quantitatively, that's the best way to do it. So my blood vessel video 2, or my video 2 for blood vessels, we are going to look at a little math. So kind of get your pencil and paper out and be ready for video 2. Thank you.